Unfortunately, we've seen a lot of patients who are black men who have the consequences of poorly controlled blood pressure or blood pressure they didn't know about. And they often present with shortness of breath or swelling or increased abdominal girth, which can be signs of congestive heart failure. And blood pressure poorly controlled damages the heart in the long run. It causes the heart initially to become thickened and enlarged and stiff, and that may result in congestion and shortness of breath. But long term, that thickened heart now becomes enlarged or dilated and weakened. It goes from being a very vigorous pump to a poor pump, and that again leads to congestive heart failure, congestion of fluid in the lungs, congestion of fluid in the abdomen and the lower extremities. And so poorly controlled blood pressure can lead to that. The other thing that blood pressure can do is also cause irregular heart rhythms. The favorite rhythm that it likes to cause is atrial fibrillation. And atrial fibrillation is where the heart on the top chamber called the atrium becomes disorganized. So rather than the heart having a good synchronous motion, that heart is quivering at the top part, and therefore you have that atrial fibrillation. And that puts you at increased risk for other cardiovascular problems. There's also another entity called the holiday heart syndrome. And holiday heart syndrome is where people may just be binging on the weekends, having a good time. It may be sometimes over Christmas or New Year's. That's why it's called holiday heart. But this can happen on a regular basis with weekend. And that binge drinking can transiently cause your heart to become weakened. It can cause your heart to go into that irregular rhythm we call atrial fibrillation. So those are just two manifestations of how alcohol can present and cause you to have health issues.